that there is nothing else around the Vision Coach other than just the plug. Now, most other units are a slave to the computer, so they have a laptop with a table and cords running to it that you have to have next to the unit, and you actually have to program everything from the computer. The Vision Coach is self-contained, so it's not a slave to anything. All the components are within, it's just a giant computer. Now, the USB port also offers the ability to upload new programs, and so you're not going to see a Vision Coach 2 down the road. This is it. You're not going to have to worry about getting this model, and 2 years down the road there's a new model with new information on it. As we develop new programs and you are a client, you'll be able to plug in a USB cord to the port into your computer, and right online you'll be able to upload new programs. Once it's uploaded, it's a done deal. So you don't have to worry about continually putting new programs in there. Once it's programmed, it's it. The Vision Coach has a ton of space for new programs, so it's not like you could only put maybe 2 or 3 things in there, a ton of space. So this wall-mounted counterweight slider, not only does it offer stability, but it gives the ability just with one finger to push it to any height. There are no electrical components within to break down, and so you can have somebody down at floor level or up as high at eye level for a 7-foot athlete. And although this is on a stand, we're kind of limited, but you have a nice tall wall space, so you could decide how high up, depending on the type of patients you had, you would need to mount it. But it really does give the ability for all patients at all levels to use the board. We have no visual cues. And as a therapist, what I noticed is all the other boards had a button sticking out, lines going out, circles, squares, something indicating where that light was going to appear. And so after I worked with my patients a few times, they knew exactly where the lights were going to be. And I thought, for number one, when I assessed them, they already knew where they were going to be. And all the other boards out there, they run on a program where it starts up in the same place, depending on the program every time, so you'd have them like this. So within the Vision Coach, you see there's no visual cues at all. You never know where the light's going to appear when it starts. Also, there's about 5,000 startup programs. Another exclusive feature you'll see is you'll notice that on some of these lights, we have letters and numbers. And I put those in there just for an extra load. When you're working with a patient, we're always trying to add everything in we can to load the system and see what they can contend with. So there's a full set of uppercase letters, a full set of lowercase letters, and 3 sets of numbers, 1 through 9. And so those could be used for cognitive loading. It can be used as a speech component if you have somebody with a speech issue. In a sports world, we really always want to load the athletes with everything we can, and this way, as they're doing what they need to do, you can have them calling out the letters and or numbers and or adding them in a sequential pattern or telling you a word that starts with that letter. I mean, really loading their mind, and you can do that with all your patients. You just have to do it at a slow pace. If you're in PT, a great thing you can do if you have a patient that, let's say, had rotator cuff surgery on the right side, put them on a physio ball, sit them in front of the board down, and program the left side of the board where they're reaching across their midline and working that. So, like I said, it's not just a visual thing, although it has that visual component added to it, but I tried to make this board, all-encompassing for as many therapies as possible.